This is the Life's Journey with Best Friends podcast. Listen as two best friends for over 40 years share our experiences, insights, and unique stories. Hi, BFFers. We talk a lot about aging ungracefully on our podcast and are always looking at ways to improve our overall health.
One of the ways to do that is to purchase quality products that are high in nutrition.
Natural Food Exchange is passionate about providing you with the highest quality, natural, and organic products. They are dedicated to promoting a healthy lifestyle through a carefully curated selection of nutritious foods, supplements, and wellness products.
Check out Natural Food Exchange in person at 39 Pleasant Street, Unit 1A in Stoneham, or visit their website, naturalfoodexchange.com.
Get 15% off of your order when you use the code BFF15 or use the QR code on our website at www.lifesjourneywithbestfriends.com. Hey BFFers, welcome back this week to Life's Journey with Best Friends. I am joined this week with our executive producer, Julie. Hi, Julie.
Hi, Noelle.
How are you?
Good. I've seen a lot of you this week.
I know. We just did that, the walk over the weekend, and then a week before you came up and hung out. So yeah, now that Diana's away, I need my other BFF.
I'm the backup. I'm the backup BFF.
Exactly. So I do want to say something before we do have a special guest on today, but there has been a poll that's been put out on Facebook and we need you to vote. So if you haven't listened to the last episode yet, this is Diana wants me to watch something called Love is Blind. And I told her I would only watch it if all of our BFFers voted that I should watch it. And I think right now it's in a tie.
It is.
So yeah, we'll see. Right. So our follower Heather made a really good point. Diana never watched Black Mirror, so I shouldn't watch this, but I won't renege. I said I would if you guys voted it. So please, get on Facebook and vote, and we'll see if I, watch a brain dead thing. We're really excited for this next guest. This is about our breast cancer awareness for October, and we'll get to that in a little bit. But Julie and I are going to chit chat a little bit. So
yeah,
we have a few more opinions about what's going on in this country, about the voting. These people are getting worse. It's absolutely insane.
And like you said,
nice to each other.
Right. Like you said, we generally on the podcast we avoid politics, because it is a polarizing topic. People have their opinions, and we don't want to come off as being on one side or the other. We know our own politics offline, right. What direction we all go in. But yeah, I would agree that the rhetoric and how people are treating each other has gotten really dangerous and to the point of violence. And that's really scary. There are other stories. You mentioned like the guys that were yelling at the woman and people yelling at the man on both sides. And you do see that. And I have people in my neighborhood who have signs up. I'll just say I'm a liberal Democrat, but I have people in my neighborhood, in my town, with signs up, and I'll drive by and I'll be kind of like, but I would never get out of my car and steal their sign or make a comment. That's their opinion, and I actually have seen a few reports of people who come out in the middle of the night, their ring alarm goes off, someone's stealing their sign, or worse, someone lit their sign on fire. And, you're on private property, first of all. Don't touch anyone's private property.
No.
But that person has a right to their opinion and if they want to express who they're voting for, which you don't have to. Nobody has to tell anybody who they're voting for. But if you want to, because you want to garner support or show your support, that's your opinion, and you can do that. And there was one story down in Florida, and this gentleman had signs on his lawn for who he was voting for, and I think it was the head of the HOA kept coming by and stealing the signs. So the
Really?
yeah. So the owner of the property ended up booby trapping it. And
Ooh.
basically under the idea of the stand your ground law in Florida,
Yep.
that he had a right to protect his property. Well, the HOA president or whoever the guy was came by, tried to steal the sign, and the booby trap went off and he lost a foot. Ended
Can
up in the
you?
hospital.
Oh my gosh, can you imagine stealing someone's sign because you don't agree with their opinion? It could have been a Halloween sign, it could have been a Christmas sign, it could have been
Oh
anything,
yeah, yeah,
right? And you lost a foot.
yeah.
What? This is what I was talking about last week. This is so
It's
asinine.
in
Like,
lighting them on fire, you could burn somebody's house down. You could kill
yes,
someone's
right,
family,
right.
like it's too much. And it's funny, you mentioned like at Halloween signs. I remember another story of like a Jehovah's Witness who went and left a nasty note because somebody had their Halloween decorations. I got one of those notes when I lived in Tingsboro
Did
from
you
somebody.
really?
I did. I got a note from somebody who was a Jehovah's Witness telling me I was going to hell because of my Halloween decorations and
Oh,
everything.
now see, that's what gives someone a bad name. That's what
Yeah,
gives, a Jehovah's Witness a bad name, or a liberal, or a
right.
Democrat. I mean, when you
I
do
mean,
something,
that person has every right to believe what they believe. But
absolutely.
number one thing in America, you cannot force your religion on me. You can't
Nope,
force your opinion on me.
nope,
I have a right to my own, First Amendment right to
that's
have my
right.
own opinion, have my own religion. You know, it's you don't take it upon yourself. I don't care if you think you're saving my soul. That's my soul. It's up to
Right,
me.
exactly. That's your
I'll
business.
I'll figure that
Yeah.
out. But yeah,
Oh,
it's just it's gone too far.
it
You
has.
know,
It really has. And it's divided this country, and it's absolutely ridiculous because you know what? After we vote, we're all going to move on and we're going to do what we have to do. And this country is still going to be here, and we're all still going to be neighbors, and we're still going to be human beings, and we need to be there for each other. So this is beyond bullshit. And I understand that you can argue your opinion. Absolutely. If you feel that strongly. And you know what? Sometimes that information that you're giving someone may help them to make a different decision.
right?
So I get that. But when it comes to violence, that's where
No,
I draw the line. I'm like, nope, absolutely not. I want nothing to do with you. This is insane. Now, when you were talking about that no one needs to know who you vote for, my husband Ned doesn't even know who I vote for. I have never told him. It is
yeah,
not his business. We maybe have discussions over things, but ultimately, he has no idea who I vote for.
yeah. I mean, it's your vote. It's
Right.
your vote. It's your right.
Absolutely.
You represent your own opinion, and
Right.
that's what
Yeah.
should be happening. That's why women have the right to vote. It used to
Absolutely.
be that it was like the head of the household voted for the household. And a lot of times that was the decision they were making was not in the best interest of the woman. And obviously, I'm not saying that about Dave. I'm
Yes.
sure he
No,
has your
no, no.
best
Right.
interest
Oh,
all the
absolutely. Yeah.
time. But yeah, I mean, women have to be able to represent their own opinion and their own
Yes.
decisions and vote for who has their best interest.
Yeah.
You know,
And it was funny, like the first year we were together, and he's like, "Who'd you vote for?" And I was like, "Nunya." And he was like, "What?" I go, "None your business." I said, "It's like, oh, okay."
yeah, yeah,
so, so that's our
uh,
little rant again. We're
yeah,
just
yeah.
carrying it over from last week. So, because it's not going to look any
No,
better in the next few weeks.
and,
So
and I know you're in New Hampshire. I'm in Massachusetts. One of the ballot questions we had in Massachusetts that I did want to get your opinion. So I don't have the language in front of me, but basically, it is question 5 is about tipping. They want the question is, do you approve of moving away from I don't even know what the tipping minimum wage, I think it's like $3 or
yeah,
something
it's
like that.
something asinine.
Moving, having a schedule between now and 2028 to move that up to $15 an hour. So that's the same as the state minimum wage. And right, as I understand it right now, how it works is that in Massachusetts, employers have to pay the difference of if, let's say, a waitress makes $3 an hour. I don't know if that's the right amount, but let's say it's $3 an hour. She earns tips, but she doesn't make it to $15 an hour in her weekly, number of hours divided by how much, or how much she makes divided by hours. The employer has to make the difference so that she gets to 15.
Okay.
The schedule is to basically slowly change that so that the employer is paying the 15%. They can still get tips, but the employer then has the option that the tips be pooled for all employees, the waitresses and the non-service employees, so like the cooks and
Yeah.
all of that. They don't have to.
Right.
So a waitress basically now could make $15 an hour and still get all of her tips.
Right.
So it depends on how the employer decides to
Right.
move forward. So my opinion was, I've never been crazy about gratuity based pay, salary.
Yep.
I've always thought that was unfair to service workers, because if somebody decides they don't want to tip, they're being a jerk, they're being cheap, they may walk away with like very little money at the end of the week.
Yep.
You
Yep.
could be lucky and have very generous tippers and do really, really well, but you could have a week. It's just, there's no stability in that. And I
Sure.
think moving away from that gratuity based salary, to me, provides more stability to them. But I get, like, in some situations, waitresses may say, hey, if I'm keeping all of my tips, then I'm making more money than if I get $15 an hour and then pool the tips.
Right.
But isn't it true that some restaurants pool tips now anyway?
Yeah, it depends on the place. So my understanding, and every place is different, but if you get a cash tip, then the server gets to keep that. If it is written and on a credit card, then the restaurant then does disperse it. Now, do I agree with that? So I understand what you're saying, that it is more of a, you'll know exactly what you're going to be making. If you're working 40 hours a week, you're going to make that. However, if the restaurant is making up the difference, then it's basically the same thing. They know they're going to be making $15 an hour. So,
Not necessarily. All right, so let's take the
if that's what
example.
they're supposed to be doing now.
Well, no, because let's say you make $3 an hour, your tips bring you up to $10 an hour.
Yep.
Then the employer has to pay you the other $5 an hour.
Right.
In the new situation, whatever tips you make, you're getting $15 an hour from the employer. Your tips are on top of that.
Right. No, I get that, but I
So
think
like that $7 that you made there, now you're making $22.
But I don't think that's going to happen. I think because we know that the servers only make $2 or $3 an hour or whatever it is, we know that their finances or their salary is based on what we tip them. If I know they're making $15 an hour, I am not going to tip them 20%. It's not.
Oh, I disagree. I will always tip 20% on the meal. Like,
I do now. I do
No,
now.
but
I
I
usually
think
do
even
more.
if they make $15 an hour, I would still tip 20%.
I probably wouldn't,
In
because the
Europe,
prices are going to go up. The prices of food, or the entrees, are going to go up, because now they have to make up, that restaurant has to make up that difference now that they're paying those people. If you think about it.
that's a possibility. Yeah, it's a
Yeah.
possibility.
Yeah.
But to me, I would still be tipping them because, but you're right. Some people may look at it that way.
Right. That's how I think
Europe,
it's going to happen.
yeah, in most countries in Europe, you don't tip at all. But it's not built into their hourly wage. They just add gratuity immediately onto the bill.
Oh, okay. So, well, that's not fair either, because what if your server sucks? I know. I guess that's
Yeah.
the chance you take, right? So I've always thought that the service industry was based on the service that they gave you, and that's why you tipped. I don't think I've ever really just tipped 20%. It's always been more than that. But except for, like I tell you, at Dunkin' Donuts, I'm sorry, you're not getting a tip for handing me my coffee.
Yeah.
If you're standing, sorry, if I'm standing while I'm ordering my food and you're handing it to me, I'm not tipping you. That's
Yeah.
what are you doing? Nothing, I don't understand that. Um, but yeah, I think there's a fine line. So I don't know. I think small business owners, that will really affect them a lot, because now instead of paying $2 to $3 an hour for 5 people, now they're going to be eventually having to pay more once they get up to $15 an hour to those same 5 people. So I think their costs now have increased. They have to push that off onto the consumer. So the entrees will go up, or they're going to say, oh, we can only afford to hire 3 people. Kind of
Mhm.
like what McDonald's did when they were forced to, pay people more per hour. What did they do? You order your own food off of a kiosk now, and there's only one person there instead of 5 behind the register. So I feel like that may happen, which would be
Yeah.
unfortunate. So I think it probably should be left up to each of the restaurants themselves. If they can afford to pay their people $15 an hour, absolutely go for it. As long as, your patrons know that when they're
Mhm.
walking in the door. Hey, and if they don't, and you get 25% on top of your freight, good for you. That's awesome. Because, most people that are in that industry tend to stay there because they make great money, because they're
Yeah.
hustling and working their ass off, you know?
Yeah.
So,
Well, we'll see. We'll see.
yeah,
November
yeah,
5th,
it'll be
what
interesting to see.
Massachusetts decides and how it all works out.
Yeah, you'll have to report back to me and let me know, because I'm
I
sure I'll
will.
forget about it because I don't have to vote on it. So,
Yeah, I'll let you know. I'll let you know. There's a few other ballot questions too. Um, I forget them now.
that's okay.
Oh, MCAS. MCAS was the other big one for Massachusetts, whether or not to do away with MCAS.
I
So,
think they should have done away with them like 40 years ago. They're so ridiculous.
yeah, because teachers are teaching for the MCAS rather than teaching the classes.
Yes.
I think I think there has to be a way of assessing how the schools are doing, but they got to come up with a better
Yeah,
way of doing it, because
absolutely.
the MCAS ends up being so burdensome. And the idea that you have to pass the MCAS to graduate, I don't know. I don't know.
Yeah, I don't agree with that, but yeah, there has to be some type of standardized test or something that you have to pass in order to say that you did get an education. But at the same time, why? If you didn't apply yourself in high school, that's your fault. You know what I mean? That's not the
Yeah,
teacher's fault. I'm sure they're trying to do everything that they possibly can. But if that kid is not willing to put in the effort, they're not going to waste their time on that kid.
yeah, yeah.
I'm sorry, it's just not going to happen. They have enough to deal with, instead of, and hopefully now you go back 20, 30, 40 years ago, a lot of those kids had learning disabilities that we didn't know about. So that was a little different then. Now, everyone's evaluated, and they should know if
Right.
there is a learning, issue, and they can have an IEP, and that's a little different. That's totally different. All right. So we would like to introduce you to Sydney. She is the owner and proprietor of Healing in Serenity by Sydney. She's a licensed massage therapist, a structural integration therapist, and an energy practitioner. I've never heard of that. So, all right. So we are so happy to welcome Sydney to the podcast today. Hi. How are you?
Hello.
How are you, honey?
I'm good. How are you guys?
Good,
Doing
good, good.
well.
So we already did your little introduction before we had you come on, and I have a question for you.
Yeah.
Before we get to your other questions, what is a energy practitioner?
So, it is like my form of energy work that I do is Reiki. So,
Oh,
yeah.
okay. Gotcha.
So
All
there's
right.
different types of energy work. So
Yep.
that's kind of my main thing is Reiki, but I kind of encompass other things into it. So I just as a whole put energy practitioner.
I gotcha. Okay. I was just like, I don't know what that is. But once you said that, okay, that totally, I gotcha. All
Because I
right.
do a lot of work with other like crystals and sound and all kinds of stuff like that too. So I'm like, I'll just encompass it all.
That makes sense. So do you have like the sound bowls and stuff?
Mm-hmm.
Oh,
Right
that's so
behind me on
cool.
thing
Oh
there.
yeah, look at that. Oh, awesome.
The smaller ones, because I don't have room for the bigger ones in this.
I've seen some of those bigger ones, and I'm like, wow, I could make a really nice loaf of bread in that thing.
Oh my gosh, they're so expensive too.
I bet they are.
Yeah.
I bet. All right, let me look up my Google Docs so I can pull up my questions for you, which I already sent to you.
Mhm.
Sydney's questions. Here we go. All right. So this month is Breast Cancer Awareness Month. And last year we had a couple of breast cancer survivors on. And this year we wanted to do something a little different. So Sydney actually does a lot of oncology massage. So we asked her to kind of describe to us, why is this, or is it really different than any other typical massages that she would do? So what is like the benefit of an oncology massage compared to, like, you know, a regular massage? Is there a difference?
There is definitely a difference. It's just a matter of safe and effective treatment for the cancer patient. It's not as if it's super, super different. It's a matter of the specifics for that individual client. So I might have to adjust my pressure a certain way depending on where they are in their treatment. I might need to wear gloves if they're taking a specific type of chemo and it's an oral chemo. I might need to adjust how they are laying on the table. They might not even be able to lay on the table. It depends.
Yeah.
So it's all different protocol. But as far as, the massage, I can still, apply touch. I can still do holding. For most cases, I can still do, kneading techniques, percussion techniques. It's just a matter of, like, you're not doing like deep tissue on a cancer patient. That is way too aggressive.
Okay.
And, most people who especially are currently in treatment, their system is, already being impacted. You only want to do so much where you're not overwhelming their system because it's already in an overwhelmed state. So
Right. And yeah, that was a question that I had too. Like, can you go for massages during your treatments, or do you have to wait until all of your treatments are over? So you
yeah, you
can
can.
do it during. That's great.
Yes, you can definitely go during treatments. Like I said, every single case is going to be different. The main thing is that if you're, like I said, getting a specific type of like really high impact radiation treatment or something like that, like I need to be aware of that so I can avoid the treatment area. I need to know exactly where the tumor site is, because you never apply direct pressure to that tumor site. I might not be able to put you into certain stretching motions because I can't move that joint that's near the tumor site. So
Uh,
it's all very case by case, very dependent on the individual's circumstance. So,
So
yeah.
I know that, in the past when I've gone for a massage, you do have to like fill out this checklist. So I
Yes.
guess it's very important for you to be honest and tell your, therapist, like, yes, I am going through, chemotherapy, or I do
Yes.
have these cysts, or I have
Mhm.
these tumors. And,
Yes.
okay, well,
And it's
very
it's even important to let them know, if even if you don't currently have cancer or are going through cancer treatment, it's important to let them know that you had previously,
okay.
because you could still have stuff that could be impacted. There could still, be potential for, it to come back. So there are certain precautions that we can take, to, like take into consideration the affected tumor site. If you had any surgeries, any lymph nodes that could have been impacted. So it's always good to let them know whether you currently have it or whether there is past history of it.
Right, because I know you also do like lymph drainage or something.
Yeah,
Yeah.
lymphatic drainage.
Okay. So that sounds like that could be impacted by that as well. All right.
Definitely. So if somebody, for example, if somebody had, lymph nodes removed as part of their cancer treatment, if the lymph nodes were being impacted, I would have to adjust if they wanted to do some lymphatic work, totally fine, totally safe. But it's just a matter of, again, how much pumping motions can I do? Like how I can't be too aggressive with that even. And on that specific site where they might have had the lymph node removed, I might not be able to do any direct pumping on that area because it's been impacted. Or I might need to do protocol for something like lymphedema, which is very common with people who have had lymph nodes removed. So it is very, very dependent on the person's case. So
Okay. Wow, that's really totally interesting. Never thought about that, but that's why we have professionals like you. So
Yeah.
that's cool. So have you I mean, of course you're not naming names at all. So have you worked with a lot of people that have been impacted by breast cancer? Or are
Yeah.
you seeing it more often now? Or like, so what's your relation with it?
Nothing that I'm seeing too often at the moment. I have had breast cancer patients previously, and even their cases were so drastically different.
Okay.
Everybody might think that, oh, it's breast cancer, so it kind of is the same for everybody. It's
Right, yeah.
not. It affects every single person very differently. You don't know if it could spread, if it might spread. You don't know what else might be being impacted with it, and how aggressive it might be, which stage they could be in, what kinds of treatments are working for them versus somebody else. It's all so individualized, so different.
Yeah, that wow, this is like so much like more enlightening than I thought. Thank you, Sydney. This is great.
Yeah, of
So,
course.
I did have another question. I just lost my question. I'm so sorry. So, so pretty much anyone can receive an oncology. Wow, try that again, Noelle. So basically, everyone can receive an oncology massage. But how would someone go about finding? Because you look it up. People that like myself that aren't really familiar with it, I'm just gonna go into Google and like massage therapy. So is there
Mhm.
something specific that people should be looking for
Yeah,
when
like
they're looking for this?
certification or
Yes.
Right.
So, the most commonly, and she's very well known as well, is Tracy Walton's oncology massage certification. That's the one I did. It's a 4-day intensive program kind of thing. So, you can, make sure you can always ask the massage therapist, have you had any like formal training with oncology? If you're, looking for specifics, like again, if you're suffering from lymphedema due to having gone through oncology treatments or having lymph nodes removed or something like that, ask them specifically, are you certified in any type of oncology massage, and or do you know any practices for lymphedema, like to help with lymphedema? So asking them specifically by what your case would be is going to be the best bet. Yeah, never be afraid to ask them questions, because it's always better to find somebody, especially if you're currently in treatment. Post treatment, again, depending on the person, you can kind of get away with going to somebody and, yeah, this was my history, and but I'm all good, I've been cleared by my doctor, like usually it's okay. But especially if you're in treatment, um, and obviously depending on what your post care might look like, you want to find somebody who is certified in oncology, who has experience being in a classroom setting with that and practicing specific things with it. And even better if you can find somebody who's already worked with somebody who has experienced a similar case or has worked with them in the past already. So yeah, definitely. And you can, if you're in a hospital currently and you're currently getting treatment, or you're going to and from the hospital and you have a specific care team, it's very common now for that to either be already part of your protocol, for them to already have oncology massage as a part of your protocol and treatment
Really?
plan
Oh,
in the
wow.
hospital. Yep.
Yeah.
And if they don't, they, again, because it's just becoming so much more common and well known nowadays, they should be able to point you in a direction of, oh, we can refer you out to this person to see them in between treatments for oncology massage. So it's much more well known and much more accepted. And yes, it's very common now in hospital settings
That's
for oncology
awesome.
patients. So
Oh, wow. That's phenomenal. I'm so happy to hear that because I'm sure, people are so emotional at that point. They're
yeah.
physically tired, they're mentally tired. Um,
100%.
I
yeah,
was
and
actually gonna ask that. Like, obviously, being diagnosed and going through treatment is
Mhm.
incredibly stressful. And you mentioned your energy work that you do. Are there certain things that people can do, whether it's with a massage therapist or on their own, that that you recommend, like to your patients, to your clients, to practice when they go home, to help kind of manage their stress around, you know, uh, either being treated with or diagnosed with cancer?
One of the main things I I often recommend to my oncology clients is breath work. Breath work is a super big one, because your hormones are already all over the place, your immune system's already impacted, you're constantly like your heart's palpitating because you don't know what's going on, you might have like too much going on. It's so uncertain for everybody, and I know breath work for me has been very impactful with calming my anxieties, putting me in a more restful state, helping me sleep, all that kind of stuff. So especially something, where you're practicing something like alkaline breathing, where it's very deep inhales, very deep exhales. You're practicing that, you're centering with your breath, all that kind of stuff. It helps you ground back in, settle yourself, quiet your mind, especially if you're having trouble sleeping because of your treatment, all kinds of stuff. So breath work is a huge one that I typically recommend for almost everybody going through cancer treatments and everything. So
Yeah, that's great. It's such a great idea. I think it helps everybody to do that.
Yeah, I would agree with that, definitely. But yeah, I mean, so I didn't have breast cancer, but going back 20 years, I was diagnosed with uterine cancer. So, and I remember at that time how anxious I was and what am I going to do? Thought of like the worst possible things one day. And then the next day I was like, oh my gosh, I've got this. I can handle it. And then 2 hours later, I was back down. So, this would have been such a phenomenal resource to be like, okay, the breathing and knowing that, go to be able to go through the massage. It wasn't anything that I ever thought of. And it wasn't anything that was ever recommended as well. So
no.
I love, love, love that they're doing that. I just think that's so phenomenal.
And depending on how like far you go back with everything, it used to just be, oh, you have cancer, no massage at all. Like
Yeah.
absolutely cannot, you can't be touched by another person besides your doctors and the nurses and so
Right.
it was just straight regular medical treatment. There was no, relaxation support. There was no, support for the immune function besides what like, the Western medicine hospitals would have given you in their stuff. They were just like, absolutely not. You cannot get massage. It's dangerous. It'll make it spread. It'll do all this stuff. And it's like, not if it's done correctly. And that's also just a wild theory that has no backing behind it. So it's, there's a lot of stuff where it's, you could argue the theory, but it's never been proven, and it's never been shown that massage is causing a cancer patient any harm during or after their treatments or anything like that.
I can't imagine that it would because it's relaxing them. Like that.
Yeah, definitely. But that's why even now, because of that theory, that's why we still take the precautions of, yeah, we're not going to put direct like pressure onto the tumor site. Like
Sure.
Obviously that's going to be uncomfortable.
Yeah, you don't want to cause discomfort.
Yeah,
That's
I don't think
obviously
anyone
going to
would
be
want that.
uncomfortable.
Yeah.
but it's also in that we keep that theory in mind still today. Just on, say it is correct, but it's very, very unlikely. And again, like there's no scientific backing behind it. It's just a theory.
Right.
And it was based purely in fear when they even came up with the theory. So yeah, so it's just, we take it into precaution, we take it into consideration as far as, yeah, we're not putting direct pressure on the treatment area. We're wearing gloves as needed. We're not if the person can't have like high circulation or they need like non-circulatory treatment, then we do that. Like we take all the precautions necessary on the minimal like off chance that it does. But again, it's just based on a myth, a theory that it's just all fear based. So
right.
But
yeah, that's good. Wow, that's amazing. So what other types of like massage, now that sorry, I'm like so overwhelmed with all the information. Like, oh my gosh. So I know now that you're talking about, massage, and then you were talking about that sound work and the breath work. And so what other type of treatments do you, and it doesn't necessarily have to be for oncology, like what else do you do in your business? Like what other things?
Oh, so many things.
Am I really going to get totally overwhelmed?
I am constantly learning. I have a list on my phone of things that I want to learn, things I already know, things I'm certified at. Like I just overwhelm myself with knowledge. But I would say the main things right now, I do the manual lymphatic drainage, a lot of deep tissue massages, specifically assisted stretching work. I do myofascial body work is a big piece of it too.
What is
I love
that?
working with, so fascia is the connective tissue in the body. It connects every single piece of you to every other thing and kind of holds us together. It's like the safety net of our body. I
Okay.
like to tell people it's kind of like if you open up an orange and you know the white fibers that are in that
Yeah,
keeping it
yeah.
together and holding its shape. That's the fascia for our body. So
Okay.
it's like this net around everything, and it's connecting everything to everything in the body, connecting bone to there, connecting this to that. And basically when that fascia, when that net around us gets very tight and constricted due to stress, overuse, overworking a certain part of the body, whatever the case may be, not moving a certain part of the body, if it gets stiff, if it gets tight, the muscle can't expand. And it also impacts the nervous system because the fascia is very heavily communicating with the nervous system.
Okay.
So it doesn't give the muscle room to expand. It doesn't give the body free movement, free mobility. So a lot of people lacking mobility, it's because of tight fascia. It's, you kind of stretch and pull a certain area, certain maneuvers for it. It's much easier to show than kind of describe.
I'm
But
sure, yeah, but that still helps. The idea of the orange. So that really, put it into my mind. So
But
now
if
that
that's really tight, then you can't move properly. You
sure,
can't, you might have a restricted mobility in your shoulder or in your neck and you can't move it. It feels stiff. It feels like it's stopping you. It's not always muscle or a tendon or a ligament. A lot of times it's the connective tissue, the fascia. And the muscle just feels tight and like it's being impacted because the fascia around it's like constricting around it. So it can't move anywhere because
Right.
everything else around it's encapsulating it.
Right.
So
So even if you work on the muscle, that doesn't matter.
Mhm.
It's the fascia.
Mhm.
Oh, wow. Look at that. You're taking me to school there, young lady.
I'm not
Yeah, it
always
makes me
good
think
with
of
I'm not always good with articulating it. I'm much more like visual, so I'm like I need to like use my hands to
yeah, it's
show.
a good visual. It's a good analogy. I like the orange analogy.
Yeah,
Yeah, when you said
absolutely.
fasciitis, all I could think of was plantar fasciitis, but
Yeah.
that is the tendon. No,
So
it's the
that's
tendon in your foot. Yeah.
Yeah.
Definitely. The fascia gets impacted with the plantar fasciitis, but that is primarily the tendon that's being inflamed. So
That's crazy. Wow. So tell us, how did you want to become a massage therapist? Like, what was this something that you've always wanted to do, or you got a massage and you're like, wow, this looks really cool? Or like, how did you come about this?
it's very funny. I never got a massage before deciding to do this.
That's
I
Wow.
never got a
interesting.
massage. I
Okay.
was little bit of a backstory. The idea was first introduced to me when I was 14. And it was only because I was at Disney with my family and my mom and I went to go get our nails done at a spa, and then she was getting a massage afterwards. And because I was a minor, I couldn't be, wandering around alone. So I had to go in the room with her. And it was and seeing it and being in the room and like noticing the atmosphere. It was the first time in my life where I saw somebody doing their job where they didn't look stressed or anxious or rushed or feel like, oh, I have, this project I have to get done. It was just, she was, sitting there doing her thing, working on my mom's neck, and she was very calm and she was talking to my mom. They were laughing. It was just a very different environment. So the idea popped into my head and I was like, oh, this is really nice. I like the lighting. I like her. I like this atmosphere. I like the working with the hands, but completely out of my mind after that. And then I believe I was in my sophomore year of high school. I started doing track. And my friend had an issue, I believe, with her neck or her back. And she was like, oh, it's so bad. It's so sore. And I don't know what came over me, but I just told her to lie on the turf. And I worked her back and her shoulders and her neck. And she felt better afterwards. And she was like, you're gonna do this for a living. I'm like, yeah, okay. Yeah, right. Okay, whatever. But it helped her so much. And then she was telling all the girls about it. And I became like the go-to girl on the track team. Like, Sydney, my leg hurts. Sydney, my neck. I was like, I should have started charging people. Like,
Yeah, no
started
kidding.
my business early. But it came very, very naturally to me. And anatomy was the one class I always excelled at. I was excited for it. I wasn't excited for any other class. I always loved the human mind and the human body. So it just very naturally, I was like, yeah, why don't I do that? Why don't I do this?
Right.
I
And look
was,
at you.
I was going to go to college for psychology. And what also solidified it is that I took a college course in psychology while I was in high school, and it was for like college credits and stuff. So I was like, well, let me, do this class. I'll pay the whatever it was, $200 to do the class and stuff. And, if I go to college, I have these credits and I have more experience and whatever. I flunked out of that class so bad. was not my, like, all the stuff that they were talking about. I was like, I am fascinated by the mind, but not like this. Like this, it was different, and the work was so hard, and it was a lot to keep up with. And I was like, yeah, college is just not. If this is what college classes are like, I'm like, I can't do that. It's just not my thing.
And people are different. Everybody's a different type of learner. Some people
my
are
other
learners
friend, other friend who was in the class with me, she loved it. She excelled at it. She was telling me about it. Once I flunked out of the class, like she was telling me all about it. And I'm like, see, like that's the stuff I love. And I love to research it on my own and like kind of go at my own pace and just learn about it. I didn't like to have to do homework on it. I didn't like to I have to do a project within 3 days. Okay. Overwhelming for me. I couldn't, it confirmed to me, I'm like, I'd rather waste $200 than, go to a school and be spending like hundreds of thousands of dollars and realize that I can't, it's not for me, it's not for everybody. So I'm glad I did that and kind of narrowed down my options and realized what I wanted to do. So.
But that's cool because you were saying that when you went to the massage place in Disney, you were like, oh my gosh, you didn't see that panic of I have to get a project done in 3 days. And now fast forward how many years later, and you're like, oh my gosh, I have to get a project done in 3 days.
I have like all this homework that I have to do, and I just don't understand. And there was all these technical terms that I just wasn't grasping. And then put me in anatomy, and I'm like, oh, this is awesome. I'm like basically the teacher's pet because I loved it so much. Like, it was like my first class in the morning, and I'm smiling there, and everybody else is like, ugh. First class on a Monday morning, and I'm there like, this is so fun. This is so cool. Like, I love it.
Oh, that's awesome. So I'm so glad that you were able to find something that you love. And on top of that, you're helping people. I mean, that's just phenomenal.
It's what I was meant to do. And I'm so happy that I was able to find it, because I know so many other people in my generation, they might go to school and they just don't know what they're doing, or they don't do anything and they're like, I have no idea where I'm going.
Yeah, you're very lucky that you found
it. I feel so blessed that I was that it just came so naturally to me, and that I was able to just find it, and I love it to this day. Like, I don't have any regrets about it. So it's just awesome. I love it.
What's your most favorite part about, like, is there a particular massage or a typical, a therapy that you love more than others, or are they all kind of equal?
Oh, that's a tough one. I wouldn't say, if I had to choose a specific therapy that I really like, I like cupping therapy. I actually have the cups right here. I like cupping therapy, where you have suction on the skin, and it helps to increase the blood flow, stretch out the muscle, stretch out the fascia, all that. It's so simple but so effective, and I think that's why I like it so much. And you can leave it static, like leave it there right on the person and leave it for like 5 minutes or so, or you can glide it, and it's just so effective and so simple. So I think I really like that. I use that with a lot of clients, actually.
Oh, that's cool.
But if I had to choose, like, it's so funny. I don't know if I have a specific technique that I prefer, or that's like my favorite thing to do. But I do have a favorite like area that I love to work on: the jaw.
The jaw.
And I do the jaw, and I do outer work and internal work. So
I'll put a glove on. Do you stick your fingers in people's mouths?
People hold a lot of tension in their jaw.
I put a glove on, and I go,
No, but
It
people
sounds
hold a
so
lot of
weird, but
attention in their job.
to me it's so fun because not everybody not every day somebody's like, yeah, can you just like go to the fascia part right in the back of my jaw here, and
Yeah.
like, but for people who have like TMJ, it is so intense. And I used to have TMJ, and I taught myself how to do internal work. I didn't even like I watched a video of somebody doing it, and I'm like, oh, I can do that on myself. And then I found specific trigger points, and I found like, oh, there's connective tissue here and all this kind of stuff going on. And I taught myself how to do it.
Wow.
And so, and I'm like, why aren't I offering this to people? Like, this is so helpful.
Right.
And it helped me so much when I had TMJ. And now I don't really have like that lingering pain, that lingering soreness, that those issues that like I used to clench my jaw a lot at night, and I don't do that anymore. And
I'm
I'm
pretty
like,
sure
why
a
am
lot
I
of people
offering
do
this
that
to
and don't
people?
even realize that they're actually doing it. Not even at night, just
Yeah.
like when they're just sitting there.
Oh,
So
definitely. So yeah, if I'm doing internal work, obviously I'll put a glove on and I'll go to like the back of the fascia here. I'll get to the connective tissue all along the cheek here, get into the belly of the muscle, because then I can grasp it from both sides and kind of do a little bit of maneuvering and stretching. It's fascinating stuff when you know like what's going on. It can feel very intense, but
yeah, I can imagine. I'm just sitting there thinking about it. I'm like, that would be a weird feeling, but I bet afterwards you're just like, oh, this is
oh my
awesome.
gosh, your jaw
So
feels like
good.
it feels like it's melted. It's like, oh,
Yeah.
it's so nice.
Well, that's very cool. So tell all of our listeners where they can find you and your website, and how they can, book a massage with you or have fascia work done and have you stick your finger in their mouth.
Like out of context, it would sound so awful.
I know, right? Totally.
No, they can find me on Instagram. It's at Sydney Barrucci, just my full name. And on my website is bysydney.glossgenius.com.
Great. We'll also put all of that information in our notes, so everyone can find that in the show notes as well. So, Sydney, thank you so much for coming on the show and talking to us. You really taught me a lot, and I really appreciate it. And I appreciate your time and all the awesome work you do. Well, thank you so much.
We're very proud of you, Sydney.
Yes, we're so proud of you. All right. Well, you have an awesome rest of the night.
You guys too.
All right. Bye.
All right, bye-bye.
Bye. Love you.
Love you. Bye.
All right. So that's cool. Oh my gosh.
Yeah.
I can't believe she does all that stuff. I had no idea. Realize it. And I don't know if any of our listeners realize that this is our friend Chrissy's daughter. So Chrissy is the one that like kept us alive as teenagers and let us, didn't let us die on the side of the road. So this is her daughter. And so we're just so proud of her, and she does wonderful work. I have gone to her for massages before. The girl is killer. If you want a deep tissue massage, oh my gosh, let me tell you, I was sore the next day. I felt like I worked out. It was great.
I need to go. I've not had a massage from Sydney yet, so I'll have to plan that.
Yeah. Oh, definitely.
Yeah, it was great. I mean, I fascinating to hear all the different types of therapies that she does, but also kind of the Eastern philosophy behind it too, and like the balance of Eastern and Western philosophies. Really interesting.
Yeah, and I loved her take on, with the oncology part. She's right. They were told, or the patients were told years ago, no, you can't do anything
with no scientific evidence to back it up.
Right?
Yeah,
exactly. So, well,
that's great.
That's good. I hope all our BFFers enjoyed that. If you have any questions, let us know. We can always reach out to Sydney, or you can reach out to her also on all of her socials as well too. So other than that, we will see you next week. So please remember that it's always better to have a friend with two chins
than two faces.
Right. Have a great week, guys.
Bye.
Bye. Sydney Barrucci is a licensed massage therapist, structural integration therapist, stretch therapist, and Reiki master practitioner, specializing in myofascia bodywork, manual lymphatic drainage, and abdominal massage.
Her work is highly holistic and she always individualizes every session, utilizing a multitude of bodywork modalities to meet her clients' needs and get the best results when working with them to achieve their long-term health goals.
She can also assist you in diving into deeper healing realms using intentional and intuitive movement, sound healing, meditation, inner child honoring, mirror work, breath work, Bowen therapy, and the emotion code.
Her practice is located at 100 Trade Center in Woburn, Mass. She's open 7 days a week, and you can make an appointment with her at 781-999-3612.
Or also reach out to her by Gmail at sydneybarrucci@gmail.com. That's SYDNEYBARRUCCI@gmail.com. Also, check her out at bysydney.glossgenius.com or on Instagram at Sydney Barrucci.
You've been listening to Life's Journey with Best Friends. For details on any of the things we've mentioned in the podcast, including photos, visit our website lifesjourneybff.com. You can also email us at lifesjourneybff@gmail.com or visit us on Facebook, Instagram, or Threads.
Remember, no matter where life takes you, you are never alone when you have a best friend by your side. Until next time.